Everyone asks whether the cancer is curable or not. Yes, definitely the cancer is curable, but it should be identified at an early stage. There comes the importance of cancer screening. So there are many cancers which can be identified at an early stage, at a very early stage actually, with cancer screening. The most important being carcinoma breast. So we all know carcinoma breast is the most common cancer in females. So this can be identified at a very early stage by using mammography. So when we should get a mammography done? Every female more than 40 years can get their mammography done every year. So annual mammography in a female more than 40 years, we may be able to diagnose almost all breast cancers at an early stage, and thereby we can cure almost all breast cancers. So the most common cancer in females is breast cancer, which can be identified at an early stage very easily by mammography, and which can be cured to a very high percentage. But in our setup, because of the cost constraints, because of the financial constraints and many other logistical issues, many a times we may not be getting our mammography, annual mammography after 40 years. So at least in our population, in populations with huge cost constraints, at least more than 45 years, get the mammography done every 2 years at least. So this is what the WHO tells, at least every 2 years get the mammography done after 45 years. So thereby almost all CA breast can be diagnosed at an early stage, and we can go for a curative intent. Second most important screening method is by pap smear. So by doing pap smear, cervical cancers can be detected at an early stage. We all know cervical cancer is very common in Indian population, and by detecting cervical cancers at an early stage, most of the patients can be cured. So pap smear is a very simple test. It's done in almost all government hospitals with a very simple technique, and we can diagnose cervical malignancy at a very early stage and go for cure in cervical malignancies. The third screening method that can be used for diagnosis of cancers is the low-dose CT scan in lung cancer. So this is a bit controversial. This is done in high-risk patients only. What are the high-risk patients? High-risk patients are those persons more than 50 years of age who have got more than 30 pack years of cigarette smoking. So more than 30 pack years, we have to go for a low-dose CT scan, and low-dose CT scan we can diagnose the CA lung at an early stage, and we can go for curative attempt. Why we are telling of the low-dose CT in CA lung? Because most of the CA lung, we all know, comes to us in a disseminated stage, either stage 3 or stage 4. So most of the time the curative attempt is very difficult to try in CA lung. By using low-dose CT chest, we are trying to diagnose CA lung in an early stage, and thereby trying to cure maximum number of lung cancer which may otherwise be not possible in a scenario. The fourth screening method that can be used is the prostate specific antigen. It's a blood test done for more than 50 years for diagnosing CA prostate. Next screening method is by doing colonoscopy. So colonoscopy is not done for all subjects. It is especially done for high-risk patients, those with bleeding per rectum, those with chronic constipation, and those with a family history of colorectal cancer. So these are the screening methods that can be adopted so that we can diagnose malignancies at an early stage, which increases the chance of curability, the chance of cure to a greater extent. So the most important screening method is by far mammography, bilateral mammography in CA breast. We can go for pap smear in cervical malignancies. We can go for low-dose CT chest for diagnosing CA lung in high-risk cases, that is who are heavy smokers, more than 30 pack years. Also PSA can be done in elderly, more than 50 years male, we can go for PSA, and another one is colonoscopy in high-risk patients. Thank you.